Good morning, everyone. Hope everyone is well. You know who it is, you know what it is. Kasim Yarn here, your favorite director, Veteran Services for our beautiful state of Rhode Island. Thank you for allowing me to come into your media outlets once again. This is the third year we're doing this, and it is truly a humbling experience. Because we know we live in a world now that we can look each other and lean on each other to talk about these things openly. And it's gonna, like I said, today, this 2 hour span, I got you for 2 hours. Feel free to come in as you want, as your leisure, from 10 to noon. We're gonna be talking about some things. And it's near to all of our hearts in the capacity too, because we know that, it's Mental Health Awareness Month, but also too, it's time for takes a pause for a little bit as well. This is our third year we're doing this, and it started during the darkness of the pandemic, COVID-19. But something that continues to grow because you know how important that the support for yourself and for your mental health. Telehealth has emerged, making healthcare easier for our people, our friends, our family ones to get community access across the country. It keeps us and others safe and away from infection disease such as COVID-19, offering care options for our physicians to assist our residents. Many services are more easier to handle and get access to, improve communication, collaborating amongst healthcare providers, but also to give you a sense of control to your health and wellness as well. I also want to ask you to pause and acknowledge the perseverance, resilience, adaptability that you have shown through this pandemic. Congratulate yourselves. You deserve it. Is it a victory lap? Yes. But however, I want to be mindful that this is a marathon, not a sprint. But we must keep the momentum going. We know that stressors from inflation, political division, economic uncertainty continue to exert a toll on our collective mental health as well as well-being. Stress, burnout, impacting us all. You may want to know that you are not alone in this mission, in your life's journey. Rhode Island is shifting from a culture of mental health from awareness to action. This year, our Mental Health Action Day calls on each one of us to take an hour or two or a couple minutes of this mental health action of ourselves, our loved ones, and our communities. This is why we're here today. While our event is scheduled to run a bit longer than an hour, 2 hours thereabouts, but it's an opportunity to feel free to enter as you leave, take some time to reflect, and also reach out to others as well to do those health and wellness checks. Another great thing that's come out, a lesson learned, is the ability to do health and wellness checks on all of us, because we all need that. I need those health and wellness checks as well, just like you do also. This event today, we broadcasted from our Office of Veteran Services Facebook live feed, and will be available for viewing after the event is concluded. Mental health is so critical to our success as individuals and as a community. It's important that we take care of ourselves and each other. I'm so pleased to welcome one of our biggest champions of this effort, and for our military, always there for our Gold Star families, our active duty Guard and Reserve, the Honorable Lieutenant Governor Celia Matos. Madam Governor, good morning.
Thank you, Director. Thank you so much, Director Jar, for having me join all of you today to speak about this important topic, which is mental health. I want to thank all of you that are turning in today. I want to thank Director Yarn for everything that he's doing to serve our veterans community. We are so lucky to have you leading this work. Thank you for everything that you do. And thank you for this initiative to get us all speaking and talking about mental health, and to let everyone know, especially all of the veterans, that it's okay not to be okay. And the first step that we have to take is to recognize that we need help and to ask for help, because that's very hard for all of us. I can tell you, speaking from experience, asking for help is tough. Is something that I have come to work on every day, and to recognize when I cannot do things on my own and I have to reach out to someone else and ask for support. I want to, at this moment, to all of you that are connected, that are watching this broadcast, I want to remind you that it's okay to ask for help. I have shared with, especially when I speak with the students, about my experience going to college here in Rhode Island College. and how tough it was for me. And it got a point in which I needed help. And I reached out to the resource services available at Rhode Island College at that time. The same way there's resources available to you. And especially to our veteran community, you have done so much for us, for our nation. And that's why I'm so proud that the work that my office does of serving you and serving the military families, and to make sure that we acknowledge you and also give you all the support that we can for you to be successful when you come back here to our state. So I want to thank the director. I want to thank Secretary Novaes was also here with us today. I also saw Tina. You're going to hear from Tina also. It's so great to be here with all of you, just to remind our veteran community that we're here to serve you. Anything you need, we're going to be here to be attentive and responsive to you and to your family. And the Office of Lieutenant Governor will always be available to you. Thank you so much.
Thank you, Lieutenant Governor, for joining us here today and those important words. I'm so impressed with the depth and breadth of expertise, commitment from our state, federal employees, our community partners, what have you. I'm a little bit emotional. I apologize, but it was okay. Just hear those words. The pandemic, millions have been impacted by this, uncovered through the mental health conditions, and millions exhibit, the challenges have been exacerbated. We're taking action to meet those needs and identify opportunities to build long-term resiliency. Speaking of resiliency, joining me now, we're going to have coming up here soon here is our Secretary Amore. It's my distinct pleasure as Secretary, his work with our Rhode Island youth as a townie. That has always been his priority to serve us in a greater capacity now. And I'm so pleased to have the Secretary joining us all the way from his office. Thank you so much, sir, for taking time out of your busy day to share with you your experiences.
It's my pleasure, Director Yarn. Good morning, and thank you for hosting this. It's an incredibly important issue, as has been pointed out by yourself, Lieutenant Governor, and so many others on this call, on this live stream. I want to thank you for all the work you do. We have become good friends over the years. We've spent time together early mornings at the airport, wishing our veterans well, and the veterans who are watching today, the men and women in our armed services. The Department of State is here for you in any capacity that you need us. You just call and we'll be there. And so, Director Yarn, it's important to point out that, mental health is health. And we all take care of ourselves in many different ways in regard to our health. And, we don't hesitate when a physician says you have to do this, walk 2 miles a morning so that you can lose some weight perhaps, or build up some strength. Take this medication because this will help you with your arthritis. And we have to look at mental health and wellness the same way we look at physical health and wellness. And it's an important point to make. And here's the other thing. Let's be very clear. Mental health challenges face every single one of us. Every single one of us. There is no American family, no Rhode Island family that is untouched by mental health challenges. And I think the Lieutenant Governor said it well. She pointed to the fact that it's okay to not be okay. It's okay to ask for help. It's important to ask for help. One of the jobs of the Secretary of State is to make sure that we have a robust civic engagement program. And many people think about civic engagement in regard to voting, in regard to elections, in regard to community involvement. Well, one of the best ways to be civically engaged is to check on your neighbor, check on your friends, check on your family members, do those wellness checks that you talked about, Director, because that is civic engagement. We are a community and we thrive as a community. And it's incredibly important for events like this to bring attention to the fact that people are here to help you. The resources are present. And you mentioned that this is a day of action. It is a day of action. And there is no shame involved in seeking that help because, as I said, we all need that help from time to time. So it's an honor for me to serve as Secretary of State. It's an honor to call you friend, Director Yarn, and it's an honor to be here today and speak to you all. Thank you very much.
Thank you, Mr. Secretary. We love you. It's amazing to hear our elected officials talk openly about, the challenges of mental health, but it also defines who we are as a state. At this point, I'd like to welcome my colleague and leader for the Executive Office of Health and Human Services, Acting Secretary Eleanor Weiss. The Secretary and I have become fast friends through her work at the Department of Health. We were talking about some of the challenges faced with our community, especially our BIOP community, also, too, more importantly, our veterans and military families. Secretary Weiss has been steadfast leader at EOHHS and has confided in me and many others as well. They've become my friend to share with me her life stories, and also I lean on her for inspiration as well. Welcome her today, Madam Secretary. The floor is yours.
Thank you so much, Director, for having me here today. You know how important this is for me. I am a psychologist by training and education, started my career as a dual diagnosed psychologist working with folks dealing with substance use and mental health issues. Many of our veterans were folks that I've seen back in the day. I come to this work also bringing my own personal family history. My family, we've had issues with mental health, with drug use, and I see it on my community, how hard stigma and culture plays a role and impacts the recovery and the journey that people take. Because getting to mental health, it is a journey. It's a lifelong journey, and we need the support of every single person surrounding us, of our families, of our communities. Here at EOHHS, that's the work we've been trying to do and to lead for the past 2 years. We really are focused on building the system of care for behavioral health across the life course, across the life cycle, not just focusing on children, on adults, but on everyone that has a need for those services. I know that later on today, the director, Dr. Serbo, is going to be talking specifically about some interventions targeting the veterans. And so I want to talk more about what we're doing in general. And so there are two main focus that we have been working very hard on with all of our community partners, trying to address what everybody has called, which is an emergency situation as it relates to behavioral health. And not just for children, and I know many call children issues an emergency, but also for the adult population, because we've had the workforce crisis that we are responding. And I say it all the time, you mentioned it, Director, COVID truly did a number on us. COVID has exacerbated many of the issues that we knew all along, but there is an interesting and critical point to make. It exacerbated them, it did not create them. And it made them be very visible in ways that we could not hide anymore. And so in response, some of the things that we are doing, specifically focusing on children, it's building a system of care for children, all children, covering all children in our state, not just children under the state's custody with DCYF, but all children, that provides a range of services from prevention to residential care, that works across the state and is seamless, makes it be easier for the families that we serve, because we know how hard at times and complicated that system is for people to even comprehend where to go, who to call when they need services. So we are also building a system that we want to make sure it's equitable, that services everyone where they need it, when they need it. So we are very proud that we received a $10 million, in fact, Substance Abuse and Mental Health Service Administration grant that is helping us build that system and develop that system. We have components of the system. We just need to bring it all together in a cohesive way, easily accessible and equitable across the state. The other big focus that we also have, it's on home and community-based services, really building not only the treatment component, but also at the community level, at the home level, building those supports that families need. And last but not least, we have been investing so much in building what we call the certified behavioral health clinics, a comprehensive way to provide behavioral health services across the life cycle for everyone. And the CCBHCs are going to be a game changer in the way they provide services, bringing all needed services in one place under one umbrella. And when those services cannot be provided, some of critical services, core services cannot be provided at the agency level, by having the relationships with other organizations that make that connection very, very, very easy. Not just a referral, but a provision of services. So we have been working with our providers in building that system, and we are so proud of the work that has been done in collaboration, in partnerships across state agencies and with community providers. I know that together, working collaboratively across our agencies, across our partners, we are going to be able to hold true to the core values of EOHHS, my core personal values of listening to the community voice, of safeguarding individual choice, and achieving health equity for all. It is not a dream, it is not a vision. In Rhode Island, it's going to be a reality because we are on it together. And we rely on people like you too, Director, to continue to push us and challenge us to do more and do better every single day. So thank you for being a partner. Thank you for champion mental health among veterans, but also among everyone, because that is what you've been doing. And thank you to everyone and for being here with us, making sure that we address this important topic. So back to you, Director. And again, thank you for bringing us together.
My pleasure, Madam Secretary, as always. It's so powerful to know that from your background, your experience, and how your agency crosses all districts, all agencies, in that because we're in the people business. And thank you again.
Thank you. And thank you for being vulnerable with us. It is so important.
It is a emotional roller coaster. We told you that up front. So just buckle up, folks, and we'll get through it together. Well, with that, I'd like to introduce you another value partner, Miriam Adapor from the Rhode Island Family Caregiving Alliance, which is part of our United Way of Rhode Island program, a key partner in our sister agency, the Rhode Island Veteran Office of Veteran Services as well. Miriam, well, will you start by telling us about the Family Caregiver Alliance and why it's so important, such an important organization for our Rhode Islanders?
Absolutely. Hello, everyone, and thank you, Director Yarn, for including us in today's talk. Mental health is something that is very important to us as an organization and to our caregivers. And so let me start off by first saying, who we are. Our mission at FCARI is to advocate for and provide resources to meet the needs of caregivers who are providing long-term in-home care for family and friends. And that includes children and youth with special needs, adults with disabilities, and our aging population. At FCARI, we believe in caregivers and their dedication, in partnerships and collaborations that further advocate for caregivers and their loved ones, and increasing the range of services and options to families. And so we're really here to try to bridge the gap. There are so many great organizations and programs in Rhode Island, and we are here to kind of be the convener of bringing everyone together so that we're working collaboratively.
Thank you. Can you tell us who your members are of the Alliance and how can someone join or gain access to the resources?
Yeah, absolutely. So our current key partners are, of course, the Office of Healthy Aging. They are the state agency that gives us our funding for FCARI. We are also partnered with 211 and our House It United Way. Our program falls at The Point, which is Rhode Island's Aging and Disability Resource Center. But we are also partnered with the Alzheimer's Association, the Rhode Island chapter, Catholic Social Services, the Economic Progress Institute, Health Centric Advisors, as well as the Long-Term Care Coordinating Council and the Providence VA, as well as another great speaker that you have for today, RAMP, Real Access Motivates Progress, which is Tina Pedersen's nonprofit. We're also partnered with the Rhode Island Department of Health, the Rhode Island Division of Youth and Family Services, their kinship caregiver unit specifically, as well as EOHHS, and of course, our Rhode Island nursing schools and the RI Parent Information Network.
You know, you talk about caregivers. A lot of times I'm hearing as I out in the community, sometimes people don't consider themselves as family caregivers. Can you give some examples of situations that makes us caregivers?
Yeah, absolutely. And you touched on something that is a very important kind of topic for myself right now, because a lot of times individuals don't identify themselves as caregivers. They identify themselves as family or friends that are just coming in to help. But if you are assisting anyone in your life with any type of daily activity, such as managing their finances, helping them grocery shop, taking care of their household chores, taking care of any of their medical needs, booking their appointments for them, their doctor's appointments, their appointments to, have everything in their life running smoothly and on track. You are a caregiver. You're providing unpaid care to an individual who needs your help. And so even if it is short term, even if your loved one doesn't have a long-term disability or illness, you're still a caregiver. And so a lot of times people don't consider themselves caregivers, but they really are. And we have so many different terms for caregivers. A lot of it is also cultural as well. In a lot of cultures, I know for myself specifically, I'm Persian, and in our culture, you don't really label yourself as a caregiver. You just do the work. You do it because you need to. It's that sense of community. And that is the same for a lot of individuals in other cultures as well. And so, I think the first and foremost, it's important for people to know that if they are doing these tasks for anyone, you are providing care. You are a caregiver.
So with that, so we talked about the caregivers, but what about the turning the camera around a little bit until the caregiver themselves? Can you talk a little about the health and wellness for the caregivers? What resources do they have?
Absolutely. Which is also a really important topic, because caregivers, a lot of times, they're caring for everyone else, but they are not caring for themselves because they just don't have the time for it. They just don't have access to the resources that they need. And so, our conference last year, we have a yearly conference for caregivers, which is entitled Caring for Family Caregivers. And last year, our topic was actually caregiving and mental health. And we had a great panel of individuals who discussed, how caregivers can reach out and access resources when they need to be able to take care of their own physical and mental health. One of the great presenters that we had was NAMI, the Rhode Island chapter of NAMI. And so it was great to kind of hear from our presenter about, resources that, yeah, exactly, yes. And so it's great to, see that there are resources available, but the first step always is to ask for help. And a lot of times that brings about shame when someone is a caregiver, because they're built and want to be so strong and independent and want to do it all themselves. But it is human to need help. It is okay to be vulnerable. And it is okay to show that vulnerability. I know that a lot of times, we want to do it all. And a lot of times we are doing it all. But that is something that would break down even the strongest of person and would cause them to have caregiver burnout. And so it's always best to seek help before you reach that stage of burnout. But even if you didn't and you get to that point of burnout, there's still time for you to reach out and ask for help. And, one of the goals that the Alliance has right now is that we're trying to push for expansion of services and programs that are available. And one of those important things in Rhode Island is TCI, temporary caregiver insurance. And this year it was being heard in the legislature to expand TCI from the 6 weeks that we currently have in Rhode Island to 12 weeks, and also expand the definition of who a family member is that you can use TCI for, but also how much of your income you're able to receive from TCI. And so, being a driving force behind all of these things and being an advocate and supporter is part of the work that we do. And we can't do that without the insight of caregivers. So you did ask me, how can people join the Family Caregiver Alliance? And it's very simple. They can just reach out to myself. And we are always looking to add caregivers to our advisory board. Our meetings are virtual and they are public meetings. So caregivers, before they even commit to the advisory board, can join and see, what topics we're discussing, how they can provide insight. And we can't do this work without actually getting the feedback of individuals that are using these programs and services. Those of us that work in this space have the best of intentions, but a lot of times because we're not utilizing these services ourselves, we don't know how we can make them better. So we need the insight of our caregivers that are using these programs and services.
Oh, absolutely. Thank you for that update. You talked about the TCI update. You talked about the legislative update. What does the Family Caregiver Alliance see as its greatest need that is not being addressed currently in Rhode Island? What do you propose they plan to address that?
So there are always 3 topics that come up at every single meeting of of what we need to address and expand upon, and what are the main issues that caregivers are facing. And for caregivers specifically, it's always related to availability and access to respite services, which provides a break for caregivers. And of course, we are partnered with Catholic Social Services that runs the Care Breaks program that provides respite services currently. But one thing that we are currently, issue we're currently facing in Rhode Island is that we don't have enough service providers. So we don't have enough CNAs and home health aides that would be able to help and provide those respite services. So that's one thing that's really important because caregivers always need a break. They need to have respite services available. Also, we are, as you mentioned in your speech, we are in an economic time where people are having difficulty making ends meet. And so programs and advocacy for programs like the expansion of TCI, like the expansion of the independent provider program or personal choice program are also important, because a lot of times what we don't include when we say family caregivers is that right before it, unpaid family caregivers. And if someone is a full-time caregiver, it is very difficult for them to manage having a full-time job with that. As many of us know, even being able to juggle your own doctor's appointments with having a full-time job is a huge and daunting task, let alone managing the doctor's appointments and the medical procedures of an individual that has a long-term illness that you are caring for.
Right. Hence, the telehealth has been such a tremendous option for all of us that can participate as well. I have been recently utilizing telehealth to address some of my concerns. It's been great for workaholics out there. It's a way to keep the Zoom meetings going. Just hop in one Zoom room to the next. But to your point, those have to have those options as well too in that regard.
Yeah, absolutely. I will say also transportation is always an issue that is discussed in meetings that I have, especially for individuals who are caregivers, but they're part of the older population of our aging population, and they're caring for someone who is also part of our aging population. Transportation has always been an issue that is also brought up. So I think those 3 are definitely the main concerns of our caregivers right now.
Regarding the State Givers Plan, how important is it to have a plan?
So the State Plan on Family Caregiving was published and publicized in September of 2021, and it is available on our website for anyone who would like to look through the plan. And so the important part was that we had never had a state plan for family caregivers in Rhode Island. It was a first for us. And so it's always important to have a plan in place to start the conversations. And what was important in our plan was that we were bringing not only insight of what we're currently doing well, but also our goals and objectives for the 2.5 years that the plan will be in effect. So the plan is in effect until September of 2023. And it's been guiding our work on how we want to create a better Rhode Island for our caregivers and the individuals they're caring for. When I always, mention the work that I'm doing and people ask, well, what's the end goal? Why are you ultimately doing this? And my first and foremost thought is I'm trying to create a perfect utopia for caregivers in Rhode Island. We are a small state, and I believe that that is our biggest strength. because we can enact programs and services on a state level without having to think of a lot of logistics and a lot of planning compared to other states. And so our size is actually a great thing for us, and is great for us trying to move forward and create a better Rhode Island.
Oh, absolutely. And you're going to hear some more folks on the call today, too, about sharing that experience. I know you talked about earlier, Tina. I know she's going to be joining the call, too, to give a unique perspective. We're talking with different folks who deal with disabilities, and that is not a death sentence. We continue to engage. Management by walking around or walking and strolling around on a stroll. Last week, she led us with highlighting where some areas are and how the challenges are with those that are dealing with disabilities, and how we can do better, and to also ease some of the, be mindful of those too as well. So this Caregiver Alliance, your team here, thank you so much for joining us. Your work continues to inspire. Your energy is contagious. And thank you for every time. I'm in the right place when I see you at an event and your organization represented there too. I know I'm in the right place as well. So thank you for all that you continue to do. Keep smiling and take care.
Thank you. We appreciate all of your work as well. And thank you for the opportunity to be here today.
Absolutely. Our got another great guest coming up to you folks. The celebrities that just keep coming in. Our next one, there's a great dear friend of mine as well, partnering with me on this journey. He joined me when we kicked out, when we did our initial inaugural kickoff back in 2021. He joined me in now, and we're blessed to have him back to update us as well. Dr. Serbo, are you out there, sir? There he is.
I am.
Doctor.
Thank you. How you doing, Director? Nice
Doctor, give me the news.
It's so great to see you. It's so great to see you. You've been a dear friend of mine since I've been working here, and I enjoy coming on this. It's such a great program that you run on Mental Health Action Day, and I want to thank you and helping the people that you do. So thank you so much.
My pleasure, Doctor. I know people tend to get tongue-tied with the name of your organization that you represent, the Rhode Island Department of Behavioral Health, Developmental Disabilities and Hospitals, BHDDH, Buddha. Doctor, tell us about your role at BHDDH, and more importantly, what BHDDH is doing in mental and behavioral health spectrum of services across the state.
Sure. What BHDDH is, like you said, Behavioral Health, Developmental Disabilities and Hospitals. It's a very large department, second largest department in the state of Rhode Island and state government. We have a division of behavioral health care, which oversees and is the state mental health authority on mental health issues and substance use issues. And we oversee the community mental health centers. We oversee the substance use facilities that are licensed by us. We also have impact in psychiatric hospitals, especially the ones that have facility status. Those are the ones that can take civil commitments or commitments on cases where they need to be immediately hospitalized because of being, unfortunately, a danger to themselves or others. We also have the Division of Developmental Disabilities, which deals with close to 5,000 consumers struggling with, developmental disabilities such as ranging from neurological disorders, medical disorders, to intellectual limitations. And then we have our hospital division, which now has actually grown in a bit. We've added the State Psychiatric Hospital, which is our forensic service. People who are there are individuals who have been deemed incompetent to stand trial. They don't understand the charges very well. They cannot converse with their attorneys very well because of a mental illness or mental defect. We also have on that unit people who are found not guilty by reason of mental illness. That is, at the time of the crime, they could not appreciate the wrongfulness of their act or conform their behavior to the requirements of the law. And we have a psychiatric unit for civil commitments. We have psychogeriatric units and also units for medical patients that can no longer be in acute care hospital but need long-term acute care needs, or we're licensed as an LTAC. So that's a large division department we have here with the various divisions that we have under that. I am currently the deputy director of this department, and I've been here since 2019. Prior to that, I was the clinical director of the Department of Corrections. So I have seen My career has been 34 years, has been separated between prison work and hospital work. And in that years, Director Jan, I've seen, unfortunately, some veterans coming through the system who have struggled with mental health issues, especially post-traumatic stress disorder, depression, anxiety, and of course, suicide. And those are some of the issues that we have to address with them here at our department.
Doctor, thank you so much for that. And you talk about a lot to unpack there. I guess one of those phrases we use now in our vocabulary. And I tell you, since we first started on this journey together, when we first conceptually talked about BHLink and the impact that it has, page forward now, we got it right. Can you talk a little more about what that program actually does and how so blessed we are to have that here, that capability here in our state?
Absolutely. I mean, what BHLink is a 24-hour community-based emergency call and triage center. It's located in East Providence, Rhode Island. It has what we call 6 bays or 6 rooms that we can place people who are in an emergency situation. Their emergency could be a psychiatric emergency. It could be a substance use emergency. Kodak is nearby, the largest substance use facility in the state that could provide initiation and induction into medication-assisted treatment for opiate crises. So it allows people to go to a safe place to try to de-escalate and to try to address their either mental health, substance abuse, or the dual diagnosis of both in one. And it's not an emergency department. I think emergency departments offer a great deal of assistance and needed work in this population who's suffering those issues. But this is also a place where people can go in a very safe, closed, a small setting to also address those issues. So I think BHLink has been a valuable asset both for the state of Rhode Island and the communities that it works with in the state.
So talk about, that you just hit a point, veteran suicides.
Yeah.
One veteran suicide is one too many.
Yeah.
60% of veteran suicides, they're not enrolled in the VA healthcare system. Of the suicides, 60% are not enrolled. So we got to change that. We're working to change that narrative to get them enrolled.
Absolutely.
Part 2 is the governor's challenge. Prior to this year, we were 2, a co-chair, my office, and Rhode Island Department of Health. Taking a step back, we needed the behavioral health team at the table. Now we have a triad, co-chairs, Rhode Island Department of Health, vets, BHDDH. How do you envision your agency's role in helping us reduce the stigma, but also to address these issues with our veterans around the suicide rates?
Well, I think that's a very good question. And of course, behind your leadership, and you made this a top priority, we've addressed this. I remember, we must remember, there's an average of about 22 suicides per day among veterans, and that's high. And that's something that has gradually reduced during the COVID crisis, but has started to come back again. And that's something that we have to aggressively address. And you took the leadership to make sure that we do address this among multi-state agencies. Now, I'm so pleased that BHDDH is one of the key partners in the governor's challenge to prevent suicide, and also is playing a key role in the Staff Sergeant Fox Suicide Prevention Grant, which enables us through federal money to work with the veteran and their families through outreach, suicide prevention services, connections to the VA, and community resources. This is a grant program that assists in further implementing a public health approach that blends both community-based prevention with evidence-based clinical strategies through the community efforts, getting right down to the grassroots of working with this population and helping them, address this issue of mental health and suicide. And the federal government, through the United States Congress, has authorized over $174 million to be appropriate to carry out this grant over a 3-year period of time. And this has been helpful. And again, through your leadership, Director Jan, of incorporating the 3 agencies and into this, helping to work with the veterans in the state of Rhode Island has been very helpful.
Speaking of a universal number, 988.
Yep.
Press 1 if you're a veteran. Talk to me about that. Talk to me about the 988. The concept is just wonderful resource as well.
Yeah, what's nice about 988, I mean, you think about it. One time not one time, we still have it, 911, where you call, we have a medical emergency. And then I think the leaders got around in the legislative bodies in the United States Congress and other areas and thought about, hey, we need a number for behavioral health needs. I mean, there's always been this, I think, underestimate of behavioral health needs in this country. 988 is a 3-digit number. It's currently active to improve the access to crisis behavioral health services. It provides referrals to crisis behavioral health resources. It's distinct from public safety purpose of 911, which is mostly focusing on dispatching emergency medical services. We will do that if necessary. But what 988 offers people is a place to converse about some of the thoughts they're having, just to talk to people at length of some of these issues. Remember, when people are having thoughts of suicide and are suicidal, it's like being in a tunnel where you're just, everything is closing in, and the light that you see at the end of the tunnel keeps drifting farther and farther away. And this allows people to call 988, to talk to someone, and if need be provided resources, possibly direction to BHLink, or an emergency room, or even a psychiatric hospital if needed. It just shows, it's another service, it's another tool in our toolbox to come out and to help people struggle with mental health issues and suicide during the most difficult times, and to realize that there is help for them to get through these very dark moments. And we don't want people to make a quick decision that's going to be long lasting among themselves, unfortunately, and the family members, unfortunately, who are going to be dear and have to suffer with the consequence of that. We're there to help.
You talked about your background a little bit, how you've transitioned and you've seen the behavioral health spectrum, and with the changes that we've made, the progress we've made. What else is there? What's our next steps?
So our next step right now, we're very excited about this. What BHDH is doing is setting up these certified behavioral health clinics. This is a SAMHSA program, evidence-based. It's federally defined as a service delivery model, and we're at the steps of developing it. And I think we're on track for February of 2024, where we will have these agencies all set up and ready to go. That's less than a year. And believe me, it was a lot of hard work to get there. It includes no wrong door entry. It improves access for children, adults, and older adults. It tries to incorporate mobile treatment programs and teams to get out there to try to circumvent hospitalizations and get them into the right care of service. And that is going to be extremely helpful. And the mobile crisis response is 24/7. It's based upon a model of getting care immediately and helping the person to get to the right place for the right needs. I think that's been lacking for a while in many jurisdictions in this country. The ones that do have it find it to be very helpful, and I think this will be very helpful too.
Is this breaking news? Are you breaking news, Dr. Servo, right now?
I'm breaking news. I feel like Lester Holt here on NBC News. It's breaking news about CCBHCs, and we're working hard, and hopefully we'll get more funding with this in the upcoming budget. And we already got funding to set up the infrastructure of it. And this will be helpful for everyone, including veterans who need it. I mean, people who served our country. My father served this country in World War II. And to see them, as it goes on, to struggle with the health issues and mental health issues, it's not needed. These are people who need a top priority. They gave their life for our country, and we need to take care of them.
But you're on to something, Doctor. You talked about being out in the community. And these, the CCB, these are where we're going. This is where we need to go, to get out in the community, to engage our veterans and military families where they are in the community. Yes, we are a small state. Yes, our size, we fight above our strength. Yes, our size is our strength. Yes, but we do know it is a challenging for this population to have to drive all the way somewhere, nonetheless. And so, but being community-based, it's about building up trust.
Yep.
And look no further than 2 doors down from me in my community. because they built that trust. And so in order for me to access a bevy of options, part of that fact had to factor in is the trust factor. And who do I trust more than someone that's in an organization that's in my community, already doing the work, already established a relationship. And that's just amazing to tap into that as a resource and to spread that across the state.
That's right. That's right. And the Veterans Administration has done this too, what they call CBOCs, these community-based outpatient clinics.
Yes.
I actually worked at one for a period of time in Middletown, Rhode Island, because at that time the federal government wanted to make a veterans drive no longer than 50. A veterans place like the Veteran Medical Center and other places, no more than 50 miles for a veteran to drive. And we have one in Middletown, one in Hyannis, and the Veteran Medical Center, of course, in Providence. And those CBOCs are equipped with both medical doctors, psychiatrists, psychiatric social workers, and psychologists. And that's very important.
See, that's amazing how our federal VA partners continues to play a role to be that pilot program, that beacon. We're finished last week was Research Week here across the nation, and the crown jewel known as our Providence healthcare system leads that work, leads the nation in research, and in our own backyard, no less. And so we always continue to leverage our capabilities from them as well too. That knowing that they were like the model for this, and to expand that coverage here in our state is truly a testament to the work. But it goes to show you that this does not rely solely on one agency, state level, federal, local. It's a community to deliver that collective impact.
That's correct, Director. Absolutely.
Well, Doctor, I thank you for the time. I know you got to get your next event, your next speaking engagement. I know you're going to be. I know you got the other newscasters are all jumping on too. But thank you for the time as well for joining us on the call for these brief moments of words. But then to thank you for sharing the opportunity about, more importantly, the role that your organization now is playing for the Governor's Challenge work, how we're doing out in the community, providing updates on programs that are coming to a community near you, a neighborhood near you in the near future with the collaborative work, just a little bit of funding. These dollars go a long way, and to have our elected officials, our general assembly members collectively working together to get this over the finish line is a testament to your organization and your leadership as well, sir.
Well, Director Jan, thank you so much for having me part of this. Thank you for your leadership. And of course, thank you for your endless friendship. I really appreciate it. Thank you.
You're quite welcome, sir. Dr. Serbo, ladies and gentlemen, back off his world tour. We're blessed to have him join us for a little bit of time as well. You know, when he talked about earlier, he talked about the SFG Fox grant, and that's so critically important to try to reduce the stigma, but more also importantly, our veterans, our suicide, it touches us dearly because, we have members that serve this nation, and that also too provide services to other families in that regard as well. So the SFG Fox grant is going to be used at work. Staff Sergeant Parker Fox, which came out from our congressional delegation that passed that into law. It gives us an opportunity to, get resources, additional resources, funding through our Veterans Administration at our federal level to get out in the community to serve those that serve in that capacity. Well, I want to pivot a little bit to our judiciary work that we're doing here in the state because we leave no veteran and family member behind in this state. We have veterans that are incarcerated in our state right now as we speak. I'm part of my initiative to provide outreach services to those folks that are incarcerated. We meet on a monthly basis to talk through the nuances behind transitioning from that environment back to civilian life. It is a daunting task as well. I pull their documentation and assist them along their life's journey to help them get reacclimated as they transition back into civilian life as well. In those calls, we talk through critical case management work because we know that through doing our due diligence, that when a veteran or military family comes across your desk from some services, by asking the right questions, they're going to realize they need more than just that one thing. And my office is standing by to assist them along their life journey. It is so critically important what we do in this mission. through the course of the day, you're going to see our information being strolled past. Please take that information, forward it to a veteran. As you cross the veteran cross the street, ask them, hey, are you familiar with the services that you may be eligible for? Do you have a copy of your DD-214? The DD-214, that is arguably the #1 document that if you served in this blessed nation of ours, that is arguably more important than your Social Security number. Granted, your Social Security number is going to be on the document itself, but that's how critical important this document is. Our office has a copy of those. We maintain those copies for our veterans and safeguard it as such. For those modern warriors that are coming out, all things all digitized. And so we have electronic versions of that too that's coming from our DOD partners. We're in the process now of potentially looking at options to maybe digitize all of our records to make it readily accessible to assist our veterans to get information to them in a timely manner in that space as well. Regarding the Department of Corrections, we meet on a weekly basis to talk to veterans that have been recently incarcerated and try to start to develop a care plan for them while they're incarcerated, be it potentially a mentoring program, but also to connecting with service providers based on their character of service in that regard. So as I dive into the work around our veterans that are incarcerated, there are some glaring information that jumped off the page as I start to review the data. Of the veterans that are getting released between 12 to 18 months from now, I want to say 98% of those veterans, based on the character served honorably. Highly decorated individuals. They took an oath, served, and they got out of service. At the time they got out, this group, they weren't offered TAP classes. TAP classes were not mandatory. There was no check-in process. There was no transition class, assistance class, TAP class, like I said before. Mandatory. And so somehow along the way, they fell along the cracks. This is why this office is so critically important to provide them service, to connect with services, to stop that. So page forward today, we've learned a little bit from this. Now it's mandatory, DOD mandatory, that if you're in active duty, you're transitioning back, you have to go to a form of a TAP class. Some classes are a week long, some classes are virtual based on the requirements, but you have to some form of a class as you transition back. Our office as well is engaged. All the other, and I speak with the other state directors as well to stay engaged, because our job is that our biggest fear is that our inability to reach a veteran where they are in the community. Resources. We're trying to change that, but you got to help us. We have blessed now, have abundance of resources, but you got to take that step. We're partnering with other agencies to address this. We partner with our DOD brother to gain access to credentials, so that way they give us an early warning that these veterans are transitioning back to a state. I represent the National Association of State Directors. There are no borders when it comes to serving America's heroes. So if Rhode Island is not your destination, if you want to go to Florida or another blessed state of ours, I have the other state directors on speed dial to provide that warm handoff, that soft landing spot for when you do transition back and Rhode Island is maybe not your destination, but like I said, you want to live in another state. That's what we do as an organization. But we need the data. We need the ability to reach our veterans where they are. We're going to use allocate some from the Fox Proctor Grant program to identify these veterans, to stay in touch, to engage, to connect them with services. It was so example was so important by going through the Department of Corrections with those that are incarcerated. 98% of those veterans, when they served honorably. They fell off the cracks some way. So it's our job to start to mitigate those, stop the leaks, and put up patrols in place to help our veterans mitigate. And also, too, you on the call, you heard a lot about family, a lot about providing resources for families, the caregivers, for giving them resources as well. And that's so critically important to what we do, to equip ourselves with doing the work. We talked earlier about, I had the pleasure of attending an event for NAMI. This is a great organization that specializes in, understanding the suicides, the mental health components about the doing the work. And it talks about you are not alone. And there's a lot of great resources here in this book. We're going to talk about them later on in the discussion as some great takeaways and talking points from the caregiver's perspective, from the individual that's recovering perspective. Excuse me, all those things important to provide a list of resources in this space to try to reduce the stigma around and reporting about suicides and what have you along those lines as well. But Big Ben behind the curtain, he was right. The tears are starting to flow again, ebb and flow. That's okay. Here's where we are. Emotional roller coaster, but we're doing what we can with what we have to. And like I said, I know I'm not alone on this journey with you as well. And so, as we continue to talk about these things, I'm so proud of the work that's being done at the Veterans Treatment Court. Another highlight of our state, a showcase of the capabilities that we have. A lot of states don't have veteran treatment courts, and we make it a priority here in that case to identify resources. And when you start to look at the makeup of the staff at the treatment courts, these are family members of veterans that are serving. We have Gold Star family members that they've lost their loved ones, but they're serving. We have veterans that are serving on the Veterans Treatment Court to help our veterans navigate the frustrations with their society, but also to the integration, and more importantly, get them the services that they need as civilians, as citizens of this state, to moving the show to illustrate that we care in so many ways where we are in the process. And again, I just want to take time out. This is why we're taking time out. This is why we're doing the work, to reflect on some things, talk through some things, to share effective practices, to be that inspiration, to talk through in that regard as well. So as we continue to evolve and pivot, I want to introduce another dear friend of mine who is probably arguably one of the top 3 advocates in the state for talking with community engagement. She's always on the radio, always out in the community. A couple of Saturdays ago, she led a walkathon to go highlight in our cities some of the concerns for those folks that are dealing with disabilities, and to educate us better and to be better citizen understanding, give us appreciation for those that you don't have to suffer in silence. There is a way. There are advocacy folks. There are advocacy groups that are out there. Without further ado, I would like to call to the stage Miss Tina Peterson. Are you there with us, Tina?
I am here, Director. Thank you so much for letting me be a part of this today. You're making me emotional, tearing up here backstage. But thank you for everything that you do, because we hold our veterans in the highest regard. And we can't thank you enough for leading the way.
So, my friend Tina here, real access motivates progress. Inclusion, diversity, equity, accessibility. You are always advocating for that. And it's so important that you address these topics because, depression, anxiety, suicide are common mental health conditions associated with lack of a sense of belonging. I'm excited to welcome Tina here. So, Tina, the floor is yours, ma'am.
Well, thank you very much. To tell you a little bit about me, I am a 4-time cancer survivor, 4 major strokes, 2 heart attacks, and suffered a spinal stroke just 9 years ago in a 5-minute procedure. I woke up 5 minutes later with no use or feeling in my legs. My life changed in an instant. I literally had 2 choices: to roll on a ball and cry about it, or to actually step out of my comfort zone and make a difference for others going through what I am. We're talking about mental health. Nothing is more traumatizing to your mental health than suddenly losing half of your body. Disability and suicide is like 82% of people who become paralyzed in their first year or have a traumatic thing. It's 82% make a plan. 50% of those actually follow through with that plan. And it's much higher in our veterans for everything that they have gone through. We try so hard to advocate and educate for people to not make a permanent decision for something that's temporary. My disability is not a death sentence. My disability is a game changer, but I had to learn to roll with it. I had to learn to find a new way of making things happen. So that's exactly what I do. I make sure the world is accessible to us. I make sure that the world is ready to handle 40% of Rhode Islanders. Again, 40% of Rhode Islanders use a mobility aid, whether it's a walker, wheelchair, or a cane. It's not just people with disabilities. It's not just veterans. It's also our aging population that we have that's over 50% of Rhode Island at this point. We want to meet them where they are. We want to join them. When I go out and give out blessing bags at 11, 12 o'clock at night, rolling through our cities and towns by myself in my wheelchair, giving out blessing bags, I meet so many veterans who are out on the streets, who we make sure are finding the resources that they need that they didn't know about. We are making sure that we are reaching out to them. We are lending an arm to them to make sure that they get to where they have to, again, before they make a permanent solution for a temporary issue. We are here to wrap our arms around you. It is okay not to be okay. Many of you have followed my story in the last 6 months. My accessible van went down and I was literally trapped in my house for 6 solid months. My mental health took a terrible toll. I mean, from somebody who's out there every single day helping other people, I have to say, and I'm going to be very vulnerable right now, but I have thought of suicide many times. I'm stuck out in Burrville by myself in a home where I was away from so many people. I thought about it many times, out of sight, out of mind. Many of us in the disability world, we lose our family. My family has walked away for the most part. I'm out 97% of the time by myself. People think that I am surrounded by so many family and friends and people. I received 21 personal text messages in 6 months. Like I said, out of sight, out of mind. It's not that people didn't care. It's not that people didn't love me. It's that people have their own lives. They get busy and they get amongst themselves. But that is where the mental health pulls into play. That is when we need you the most. That is when we need to at least hear from you and say, are you okay? Is there anything I can do? That text message could go so far. That phone call could go so far. Reach out to your neighbor, check on your neighbor. If you don't see somebody going in and out of their house, go and check on them, send them a note, put something in their mailbox. Let them know that they're not alone. Let them know that there are people there for them. Because I'll tell you, I may not have been here right now if it wasn't for the love of everybody to help me raise the money for my van. It was a very scary time for me. And I'm a very outgoing, positive person. Like I said, I've overcome so much. And that is what was almost going to do me in. And people don't realize that. But we're here for you and we love you and we care about you. I go out of my way to reach out to strangers on a daily basis. A smile could change their whole day. We can do so much. So RAMP is here to help you in any way we possibly can. And we work directly with Director Yarn because like I said, a lot of the people that I meet out on the street and the homeless, yes, there are disabled homeless. They're not homeless because they don't have the money. They're not homeless for any other reason that there's no accessible housing for them right now. There's no place for us to go. A lot of the shelters for them are not accessible for wheelchairs or family members. If you're a couple, one has to go to the men's shelter, one has to go to the women's shelter. You don't want to leave when you're disabled the one person who knows you the most, the one person who knows how to take care of you. You don't want to be separated from them, even for a few hours. It's very scary that we need to address that. We need to address more housing for couples, for partners, or whatever way that they want to be. We just need to be there. We need to reach out. We need to be vulnerable, and we need to tell our stories. We need to let people know that we're feeling what you're feeling. We're going through what you're going through. Like when I have told people how badly my mental health was in the last 6 months, they're like, you're always smiling, you're always posting, you're always uplifting. I'm doing that for me. as much as I'm doing it for other people, because reminding myself every day that I could be making a difference, I could be changing the world for somebody else like me so that they don't get to this point, is what keeps me going. And this is what I want to keep you going. Don't make a permanent solution for a temporary problem. It's okay not to be okay, and we are all here for you.
When I saw you that Saturday showcase that van, it was phenomenal. More bells and whistles than anything. You know, it's amazing to see that, and that impact it's had on you, and to be a motivation, to be the first of something, not the last, but the first, and the glass ceilings that break as a result of that. Talk briefly about your recent award that you were just bestowed upon being the first.
Oh, there are so many, but thank you for my van. My van is beautiful, and I'll tell you, the minute I got behind the wheel of that van, first and foremost, you could feel the weight of the mental health of me disappear, because I knew that I was back out in community. I knew that I was going to go find those homeless people that I was helping, and I could make life better. I knew that I could go out and do my work, even though I'm doing it alone and I'm out 97% of the time by myself. Just knowing I could change a life makes a difference. But I am honored to be appointed to the United States Access Board by President Biden. It's such an amazing thing that I'm going to now have federal say and be able to take federal dollars back to Rhode Island and make real change on a federal level to make sure that nobody loses family and friends, because the world is accessible and family and friends will be able to take people out and to be engaged, and people will be able to be there for each other. It's something that is one of my biggest highlights of everything that I do.
You know, Tina, so much, that's so critical, and, that inspiration, I know it's like, it can be lonely, but when you're leading others, there is no greater blessing. And your words of encouragement, sense of empowerment, resiliency, support system, all come into play here in that capacity. So I know we got to get you out of there. You got a bazillion things on your plate today. So what's your next event so we can go show up at, so we can support your efforts?
Oh, well, actually, my next event is more for other people. I show up at other people's events to make sure that disability is seen, that disability is represented. When I show up, like last night, we were at the Rhode Island Foundation annual 40% of Rhode Island use a mobility device. I was the only one in the building in a wheelchair. We need to let people know that places are accessible. We need to let people know that we belong there. We deserve to be there, and our voices need to be heard too. But I do have my big event in September called Accessibility is Beautiful that Director Jan always speaks at. So that is September 23rd, 2023 at the Steel Yard, 11 to 5. We are so excited, and we would like you all to come on down and be there and let us be the resources for you.
And I think you're doing something special as well for the Veterans Home, I believe.
Yes, we were just granted to give out Tina's Table. For those who don't know what Tina's Table is, I was sick of waiting for everybody to invite me to their table, so I literally created my own, and I was actually the first welding student in a wheelchair that actually welded the table together with the Steel Yard. And we are donating a Tina's Table. It fits 3 wheelchairs and 8 people at the table, but when everybody sits at the table, the chairs are wheelchairs. So everybody is actually sitting in a wheelchair, so everybody is the same, and everybody has a seat at Tina's Table. And we are donating one to the Veterans Home, and we cannot wait for that to be completed and give it to you. That was one of my goals. I told them when Tina's Table came out, the Veterans Home was getting one of the first that we could actually donate. People are buying them, so they're out there, but we're donating one to the Veterans Home because nothing is more important to us than our veterans.
Well, amen to that, Tina. And thank you for all that you do. And I know for a fact you're going to be calling me soon for the next event. You already got me booked up for the next event. I know you're going to be booking me for the next one and the next one and the next one. But it just talks about so critical this work that needs to be done. And so thank you for all that you do as well, and look forward to your next event along life's journey as well.
Oh, thank you so much for having me. Have a great day, and stay well, everybody.
Thank you, Tina. Wow. If that doesn't get you, nothing else will in that regard, but again, talks to resiliency, the need of a support system is so critically important in that regard, as well. And, like I said, take some time to reflect a little bit. Health and wellness checks with your friends and loved ones go a long way, can help somebody. As simple as a text or a phone call. I like surprising folks with FaceTime, and I've learned through my telehealth visits that, having that face interaction with someone, it's easy to hide behind a text. I've never been a leadership by email type of guy. I am a people person. And, to do that, you have to utilize those tools to stay engaged. And FaceTime is one of those options via text. I love group text as well with folks to stay engaged in that regard too as well. It keeps me, it's my source of inspiration as well. Woo! Everybody doing okay? Take a deep breath, everybody. We're getting through it together, so, we're getting close to call wrap up time here, but a little bit too as well. But I know that hopefully we're able to just take a little bit off of this too as well. And I do believe I got another friend of mine joining me as we get ready to wrap up here. That's to pivot back to our judicial discussion. Mr. Rich Flynn, our federal VA partner, back at it again. Good morning, sir. Full disclosure, I was just on a call with Mr. Flynn this morning, approximately like 9 o'clock this morning, I think. And we were developing strategies to engage with our veterans that are coming out of incarceration, 18 to 12 to 18 months. Mr. Flynn, welcome, sir. Welcome to the call.
Good morning. Good morning. Thank you.
Good morning again, sir. So, Mr. Flynn, tell the listeners, the viewers, what do you do and what's your mission? What's your role?
So, Richard Flynn, I'm a social worker in the homeless teams at the VA, primarily what's called Veterans Justice Outreach Programs. So we are the outreach component of the VA into the criminal justice system, primarily courts and prisons, where we are looking for and trying to connect to what we term justice-involved veterans. And I came onto the call at the behest of a colleague I work with in the Rhode Island Treatment Court, who couldn't unfortunately be here this morning because she had a childcare crisis, so to speak. And she was asking if I'd do a little overview of the Veterans Treatment Court. I'm not sure if that happened or not, but I'm happy to do that. Or I can talk more about what I do on a day-to-day basis.
I talked a little bit about the treatment court, how it's unique in its kind in the nation. Where not every state has this, and how it's another impactful reason why Rhode Island is so special, because we have those capabilities, and we're touching every veteran across their life spectrum, where they are in the community, be it in a home or be incarcerated. If you served honorably, or we are developing resources to assist you in that capacity. And what if you didn't serve honorably? Well, there's another list of resources that we can assist you as well. And so, Mr. Flynn, please talk about the floor is yours, open mic session. Happy for you to talk about cover down on the treatment court stuff, but also, too, the critical work that you're doing behind the scenes by going inside the ACI, meeting our veterans where they are and engaging with them, and talk about that experience also.
Sure. Thank you, sir. So yeah, VJOs, or Veterans Justice Outreach, has been around more or less since around 2009. I came into position in 2011. There was not a VJO here at the VA. So, a lot of those contacts that the clinicians were having or the hospital were having with folks who were justice involved, there was no really integration or communication. It was strictly based on one-to-one relationship. So there wasn't really any agreed or strategized or planned arrangement where we would actually locate, find, and capture to some degree the number of veterans in the criminal justice system. Nobody had done it. Nobody was really aware of it. There was only one statistic that was around, and that was from a Bureau of Justice analysis done back in 2006 that estimated that the actual veteran population across the country was somewhere between 9 and 10%. That's a staggering number. when you consider that, the general knowledge point is that less than 1% puts the uniform on, yet nearly 8 to 10% of the prison population is represented by people who have served some capacity of military service. So this was a huge anomaly, and it was certainly a cornerstone issue for homelessness amongst veterans because of the cycle between going in and out of prison was considered one of the key components that creates homelessness in the long term and becomes a chronic issue. So that's how the VA kind of got involved in looking to do interventions in the criminal justice system. And VJOs were considered the point of entry for that. So there are now generally, when I started, there was nobody here. Now there are 3 VJOs in this facility covering Southeastern Mass, the Cape, the Islands, and Rhode Island and Northern Connecticut. And we kind of break the work up that way, usually across geographical grounds. So we are really about creating relationships with our partners in the community. And that means, the State Office of Veterans Affairs, that means the prison system, that means the court system on any capacity from the highest level down to the day-to-day, working with the sheriffs, working with prosecutors, working with attorneys, and most importantly, working with veterans. And the goal really is to create some kind of path into treatment that could be reflected in a reasonable disposition for that individual in the court system. Now, our job is not to get people off. Our job is to look at an appropriate response to a situational event. And if there's any indication that is reflected in that veteran's experience of military service, then we want that responded to in the court and understood, accepted, and respected. And that's how we get involved in that. So, that's the real purpose of VJOs. It's to do that intercept across the sequential intercept model as early as possible. So generally that means we try and make relationships with police officers. If not them, then the next point is the court. If not there, then the prison. If not there, then parole. So we're involved right across the continuum. So that's the overview of what we do.
Richard, thank you. You talked about something, we this morning kind of, I guess in a way, kind of set the tone for today. We were on a call, we had, as I was sharing with, before you came on the call, I was sharing with our viewers how we have our monthly data call and we go through the list of veterans that are going to be released within 12 to 18 months. We had one veteran that get recently released, and we're tracking, we list the phone number. During our call, we picked up the phone and we listened to her, and she was not aware that she was eligible for VA benefits based on her character of service. We pulled up her records. We walked through the case study because she provided us consent, and guess what? She's eligible for services. And so at noon today, a member of my team is going to give her a call to start the enrollment process. We can make progress, folks, but it takes work. You got to get dirty. You got to roll up the sleeves. Richard, you talk about this all the time about doing the work.
Yeah.
Well, Mr. Flynn, thank you. I hold us that time. Thank you so much, sir, for taking opportunity out of your mission. Your role it continues to evolve, and I look forward to our next engagement. Matter of fact, we'll be meeting next Tuesday to do our next iteration of the discussion.
Yes. Thank you for the invitation. Anyone has questions, they know how to reach out to me. Kasim has my contact details. Knows how to get hold of me and my team here.
Oh, absolutely. Thank you for your service. Thank you for your support.
Thank you, guys. Have a good day.
Yes, sir. Woo. Thank you, Richard. So, as we come to a close, thank you for all the understandings that, we have concerns about yours and everyone's mental health in that capacity too. But we can't remain silent about this. We have to take action. And this is our method we're using in order to take action. We continue to build upon the model to keep that momentum going. You are not alone. And the governor says we are one team. And we can meet those challenges by having that mentality. It is time that we care for our emotional well-being the same way we do our physical health. We're taking actions now to build long-term resiliency and to meet the needs of our community. And as I reflect on today, years past, getting up to this moment, to see where we've gone, we're taking action. This is a quasi-victory lap, I should say, because we made some improvement. But it's no mean at the end of the race, because it is truly a marathon. We've seen how we still have concerns. We still have folks that are not reaching out to the VA. We have folks that are not enrolled in the VA healthcare system. We have family researchers that are lost hope, per se. We talked about, Tina shared a little bit of her experiences, what it takes to pull you out of debt and to move forward. And not only move forward, but be an advocate for other people. But we know that we got to turn that mirror around and look inward to be an advocate for yourself. I had the pleasure of working with NAMI, the National Alliance of Mental Illness. And in this book, You're Not Alone, offers an evaluation criteria. The FTD test, fit, trust, and discuss. Fit in terms of it has to feel right to you. This is why my vision is to address this issue, is to offer a buffet of services that you can make based on you, the individual, how it fits into your schedule, your life, along your journey. And also about trust. That takes time. But also, what I'm looking forward to what the BHLink is doing is instilling in the community. It's why part of our outreach efforts is to meet our veterans where they are in the community. This Saturday morning, from 9 to noon, we're going to be in East Providence to provide resources for our veterans in the community. We're doing town hall events. Tomorrow, I'm going to be at New England Tech, visiting with the veterans that are enrolled at New England Tech to meet them where they are. Later today, I'm going to meet with the mayor of Providence and the mayors of East Providence to sit down and talk to them how we can collaborate in a better way to service our veterans that are in the community, to help build that trust. And I know both mayors are committed to that work. And lastly, part of it is to discuss what's on your mind, not just what you think you should be talking about, what comes up. And I hope that this provides encouragement for you to do what you feel is right in that space. We have an array of services that we offer. Our office, 921-2119. Walk-ins. We're one of the state agencies that we open our doors for the pandemic because we know this is who we are. We are in the people business. We have to have the ability for our veterans, our military families, our Rhode Islander, our constituents to come to us for assistance. And when they come to us, David, you better pick up the phone. You better be there for them. The Vet Center, a community-based counseling center that provides individual, group, families services. Guard and Reserve, active duty, you're available. They're a quasi-agency because they are not allowed to share the information with anyone. It's talked about building trust in the community. We heard all about BHLink, the hotline, 414-LINK. A great, great opportunity. We got KidsLink. We talked about that in year 2. 1-855-543-5465 is the behavioral health triage service and referral network for our children and youth. We talked about the national hotline for our veterans, 988, press 1 for veteran. Our internal, we have our state's 211 number to connect you with services as well through our Unite Rhode Island, Unite Us platform. The book talked about 5 essentials. Have hope. It's on our state flag. Glaring at us. Take personal responsibility. Look at ourselves in the mirror. Be comfortable who we are. Be motivated to try to take the steps you need to be a better person along your own life's journey. Education. Take control. Advocate for yourself. Engage with your primary care physician. Ask those right questions. What are the effects of me taking these various, what are other therapies that are available to me out there? And of course, Tina talked about she alluded to us a little bit as well, in terms of our ability to connect our veterans where they are, develop a strong support system. Being a member of an organization in your community, volunteer, stay engaged, take that step. In Rhode Island, our side continues by our strength. We do stand together. Thank you for joining me today, folks. In Rhode Island, mental health matters, and I will see you across the state. As always, stay blessed.